I think the most important thing to realize is that a lot of women experience pain during their period, but if that pain limits your ability to do daily activities, you should talk to your provider about that pain and you may have endometriosis. I'm a reproductive epidemiologist and I study gynecologic health, so I'm really interested in the causes of gynecologic health conditions as well as those consequences of gynecologic health conditions. Endometriosis is considered a chronic gynecologic condition, and it occurs when endometrial-like tissue, so tissue that we usually find lining the walls of the uterus, is located outside of the uterus and it's growing outside of the uterus. We estimate that this burdens around 10% of women in the United States, but it's hard to get a perfect estimate based on some of those complexities of studying the disease. One of the areas that I'm really interested in studying is thinking about what are the long-term health consequences for women with endometriosis. So we observed that women with endometriosis were at about a 34% increased risk for stroke later in life. Traditionally, it's a little bit challenging to study because endometriosis is being diagnosed earlier in life and then stroke isn't happening until much later in life. I think there are two lines of research that we want to explore. So we know that women with endometriosis are at increased risk for other cardiovascular conditions. We think that one of the potential mechanisms is through inflammation. We know that women with endometriosis have higher levels of systemic inflammation, but we're not entirely sure kind of how a condition related to gynecologic health could be associated with some of these cardiovascular endpoints. The other path is prevention, right? So understanding, can we intervene on these women earlier and prevent that increased risk of stroke later in life? And what do we need to do to intervene on these women? Is it potentially increasing physical activity, changing diet, thinking about the traditional cardiovascular risk factors, and what are ways that we can maybe manipulate those among women with endometriosis to make sure that they have a similar risk profile to other women.